Dr. Jaffe, one of our customers writes in and asks, would you ever recommend hormone replacement therapy? Why or why not?
Very important question. Hormone replacement therapy, both for women and for men of a certain age, let's say 50 plus, maybe plus or minus a few years there. We have found what I learned from a professor named Feinberg in the 60s, applied at NIH in the 70s, and to protocols that I've developed over the decades. We have found that in almost all cases, you can restore hormonal balance by restoring neurochemical, immune defense and repair, digestive and detoxification competence, and that is doable based on mostly saliva, urine, some blood or blood spot tests interpreted with experience, which we can add to the interpretation and are available to explain to anyone from an active consumer to a health coach to a colleague, how this all fits together to restore the normal rhythms, the biorhythms, the life rhythms of hormones. Now, let me say something quite in addition. Depending on the symptoms of the person, perimenopausal symptoms, menopausal symptoms, postmenopausal symptoms, andropause, there is a male version of menopause, it's called andropause. And there are definitely times when, after measuring in saliva the stress hormones, the anabolic and catabolic hormones, often known as the female and male hormones, but in some detail, after you have that baseline measurement, for a short period of time, you may want to provide the healthier estrogen called estriol. You might want to provide some progesterone. You might want to provide, in some situations, some pregnenolone. If you identify a cortisol steal, you might want to introduce green dichromatic light, therapeutic biofeedback, learned optimism, and restorative sleep to undo the stealing of anabolic hormones, converting them into unhealthy estrogens known as the cortisol steal, the cortisol stress hormone steal. These are issues we have folded in through our experience into how we interpret results of the predictive biomarkers, including the LRA by ELISA Act and the Health Appraisal Questionnaire, the HAQ Health Appraisal Questionnaire, that helps us personalize the interpretation and guide the 6-month plan to evoke healing responses, to repair, to evoke normal hormone balance. And then we come back after 6 months and measure again. Now, I did say that there are definitely times when relieving symptoms of too little progesterone is a smart thing to do for a short period of time. But don't overwhelm a system with an active hormone product that has feedback to both the gut and the central nervous system, because you can make the body dependent on those very hormones that are being replaced. So we don't rush in with hormone replacement. We do selectively use compounding pharmacies in general to provide high quality, high bioavailable progesterone, pregnenolone, testosterone, if it's appropriate. But usually we come in with the precursor and let the body, once it has been rehabilitated biochemically and detoxification-wise, once its healing responses have been evoked, once the body is in elective protective mode, then hormone balance is just naturally provided. And my experience, especially in regard to preservation of bones and muscles, especially in regard to preservation of brain and digestive functions, my experience is that the best solution is to evoke healthy hormone balance naturally. That's what we start with. knowing that there are little moments when you might want to bridge someone for a short period of time so that they get enough relief to have some hope that your information and inspiration, combined with their best efforts and their quote perspiration, will make a difference and will achieve healthy hormone balance for life, which includes healthy brain and gut function, healthy bone, muscle, and joint function, healthy joy of living and desire to get out and about, all from healthy hormone balance, naturally evoked.